So now I'd like to turn it over to Ms. Katina Beard, who's the CEO of Mathew Comprehensive Health Center. And Ms. Beard is going to speak from the provider perspective on the ground. Ms. Beard?
Good morning. Thank you, Tanae. I am Katina Beard, Chief Executive Officer with Mathew Comprehensive Health Center. Can you hear me, Tanae?
I can, yes.
Great. And so I just want to give just a little bit of background on who we are and how we kind of tie together. So Jackie, you could just hold right here on this slide. So we are one of about 22 federally qualified health centers across the state. We have locations in Nashville, Clarksville, and Smyrna. And we are a part of this very intricate, very complicated system of healthcare in Tennessee. And we were founded in 1968 by Dr. Walker to address the exact issues that Dr. Cahill brought up in her presentation to address communities that are living in poverty and providing access to healthcare so that they can have the best health outcomes and have a chance at longer years of life, their potential years of life to be as equal as those in other areas with access to healthcare. And so federally qualified health centers, charitable care health centers, hospitals across the state, we are a part of this system that is caring for this group of individuals that we are concerned about extending access to health insurance coverage through TennCare or other means too. And so I just want to kind of explain from our perspective what we're seeing. Next slide, please. So again, this is a map of where we're located. Jackie, you can go on to the next one. So this is a comparison of our health center patients that we've seen by payer this year compared to last year. And I know when I did this slide, I was like, well, nothing from 2020 should be compared to any other year. But I do want us to see that the effects of what has happened in 2020, the pandemic, the job loss, the loss of insurance, the continued poverty in communities, this is what the result will be. So in just this 1 year, we saw in 2019 that our number of uninsured patients was at 56% of our total patient population. It has grown to about 60%. And so I want us to know that this number of patients is going to continue to grow. And so we will have the need to continue to provide access to care for a growing population of people that by their own account has not, did not contribute to being without insurance, but now find themselves in this position. And so our percentage of individuals with commercial insurance decreased, as well as the percentage of our patients that had TennCare also decreased over this past year. And so we, along with our other peer health centers and sites, are very focused on providing care to this population of people. We are focused on this TennCare 3, as Dr. Myers has put it, this block grant waiver that has been signed specifically in terms of the restrictions that it will put on drug costs, the types of allowable drugs, and the increased barrier that will put to our patients in terms of improving their health care and the opportunity to do such. Next slide, please. So until the gap closes, what you have across the state are safety net organizations like myself, like others across the state that are focused on providing care to individuals regardless of income. So this is great on the ground, right? We are doing the best that we can in providing primary care services, well women visits, well child visits, making sure that we are on the front lines of immunization. But there are times and instances where many of our patients need a second step to healthcare. And so providing access to care for secondary services, for cardiology appointments or radiology appointments, or even just diagnostic mammograms for some women are out of reach for uninsured patients. And so closing the gap means not just providing access to basic services, but those services that become very costly to individuals, that if they are in the hospital, if they unfortunately end up being hospitalized, creates much more of an income challenge in their home, and continues to allow or forces families to live in poverty. And so I say that, when you go to the hospital and you receive a bill and you can't pay that bill, and you are then placed into a collection situation, or now you have this situation with your credit, you can't, it's very hard to dig yourself out of those. And so we are trying to be the gatekeeper at the safety net level of maintaining health for individuals, so that they can have access to health care that's affordable, that is regardless of your insurance status, to try to help keep those individuals that are already in poverty, living in poverty, without having to gain additional bills outside of themselves that will create further barriers for them. Under the Safety Net Consortium of Middle Tennessee, we have a website, My Healthcare Home, that allows individuals to find the safety net access point in their area in Middle Tennessee that best fits them. We're not all created in the same make. And so some may need dental, some may need other services. And so we've created this to make it easier for people to find access in their community. Project Access Nashville, and this is across the state. There are other project access opportunities across the state, but in Nashville, it includes disease management, access to pharmacy services, and dental. And this has been very important for us because it has allowed a network of providers to come together to provide care for individuals at that second level that I discussed earlier. And so if we have a diabetic patient that needs a nephrology appointment that does not have any insurance, they are able then to go through Project Access to find that appointment. These appointments are very few. There are many providers in the area that do not accept TennCare. There are many more who do not accept patients without any insurance, and their fee-for-service is just out of reach for our patients. And so this is a very important project for us to be able to extend care to our patients. And then finally, our Smile on 60 Plus program, which was new in these last couple of years to extend oral health to older adults in Tennessee. Tennessee had one of the worst records of adults without teeth, and having teeth. It's very important to an individual's ability to have proper nutrition and access food. And this was very, very concerning in our older adults. And it's also important to know that oral health is important to accessing jobs. And so again, how your health plays into your wealth, having a smile, and I know this may seem very, odd to those of us who haven't had to deal with this, but having a nice smile or not has been a barrier to individuals having a job or being employable. And so we find ourselves serving in various roles while this gap closes. And even as the gap closes, there will still need to be infrastructures in place to help patients, to help our residents be able to access care so that they can stay healthy, so that they can maintain the wealth of their home, so that they can grow out of the areas of poverty that they are in. And so that's just a very quick overview of my perspective as a provider of health in the state and what this closing of the gap would look like from our perspective. Thank you.
Thank you, Ms. Beard. And I'm very appreciative that you also brought into the conversation oral health. I think that's something that we tend to add on to the conversation as an afterthought, but that's very important even with regards to our physical health.